me record or were you going to?
Okay, I think I got it. I think we're recording. Did you all get the message?
Did others? I didn't see it.
I didn't see it.
Oh, I think I can see it right there. Yes, we're recording. Okay. All right. Gosh, sorry about that. Thank you all for coming today. Let's jump right in. Today we're going to talk about identifying issues. Everyone has had a chance to, I believe, open up and log in and kind of take a peek at what the HATS assessment looks like. And we're going to start with a quick icebreaker. I cannot see all of you or the chat, so feel free to Nicole or Emily, if you guys want to speak up, or actually anybody can speak up and monitor the chat and send me questions, okay? So, let's go back. Here we go. Okay, quick icebreaker. What is your favorite vacation destination? We're gonna kick it off with that. So if you are not sure about a vacation destination, you could think about maybe a favorite subject in school growing up. And I'm gonna keep moving through the presentation while you guys put those ideas and thoughts into the chat. The quick acknowledgement that we do at every session. TEAMS program curriculum and materials was created by the American Academy of Pediatrics through funding from the Center for Disease Control and Prevention. Participation as a TEAMS trainer does not imply endorsement by AAP or CDC of any individual organization product. So trainers are not employees or agents associated with the AAP or CDC. I'm going to move on to some quick housekeeping. Today's presentation is being recorded. A link to the recording will be shared with attendees. Everyone's is muted, but since we have such a small group, if you guys want to talk or have questions, feel free to unmute and ask those questions. If you feel more comfortable using the chat box for questions, that's fine too. And just know that I can't see the questions in the chat box. So I'm gonna have I think Penny is here as well now and can help watch that chat. Okay, so moving right along to the agenda, today we're going to do quick welcomes and introductions. We're going to look at identifying issues as you're going through the HATS assessment, like how you're going to decide what issues to focus on and prioritize. We'll do a quick tour, even though you guys have already accessed the login, just to make sure you know what all the tools are and what is available. And then we're going to just do questions and next steps. So it'll be a fun day. And then let's see. Did we get anything good in the chat for destinations? Hi, Penny.
Hello, I'm not seeing. Oh, there's the chat. Oh, we do. We have British Columbia, Yukon Territory, and Alaska, Charlotte, and
North Carolina,
and cities around Europe.
Nice.
That's what we have.
All right, by the end of today's orientation, you'll be able to explain the importance of using data to identify areas needing improvement. You'll be able to identify different types and sources of data to assess student health needs, complete that health services assessment tool for school. And introductions, just a quick recap. Tammy Diaz, I'm school nurse specialist named DOE, and Penny Townsend is here as well. And she is the school-based health center program coordinator with the Department of Health and Human Services. And you can reach out to either one of us anytime if you have any questions or need some technical assistance. Moving right along, looking at, we're gonna go back to the TEAMS framework when we're looking at identifying issues. This is part of the framework. It is step 2. The first step is getting your team together. And we talked about that and also looked at this framework. Hopefully you've all had a chance to meet with your teams. I think the Brunswick team has had, if I remember right, 2 or 3 sessions already with their teams. So they are diving in full force. Is anyone else here from any of the other teams? Nope, looks like just Brunswick today and our team. All right. So project focus areas. There are many areas that you could work on as part of this project. Some of the things that you might be thinking about would be maybe developing or revising school health services policies and protocols, improving schools' health services and programs to enhance and expand access to physical, mental, or behavioral health services, or maybe oral health services, strengthening coordination and linkages with other organizations and providers might be something you might think about. Implementing more effective staffing structures. We know with our schools sometimes, you know, having subs available or people available to cover if we're have to be out unexpectedly or even expectedly sometimes. So maybe staffing structures is something you want to look at. Also improving data collection and evaluation, as well as securing additional resources for health services. And with the TEAMS model, your team will select areas of focus based on your needs and circumstances. So how will you decide? There's a lot you could work on, and we talked about this a couple of times. Time and resources are limited. So to help you identify your focus, you're going to start with a systematic needs assessment process, and so that you can choose your priorities based on data. So the needs assessment, although you may have already have some sense of students' unmet needs, as well as strengths and weaknesses of your health services, it is still important to collect data. Collecting and analyzing data allows you to discover and describe your school district's gaps and strengths in a more precise way. Test your assumptions. We often think we know what the issues are, but are sometimes surprised when we actually look at the data. And it also gives you information to help you prioritize. It builds credibility and helps you make a case for change. And it also establishes a baseline for tracking improvements, which allows you to demonstrate the value of your work to your partners and your administrators and all of the people that you work with and serve. So as part of this assessment, there are 2 components that we need to look at. The first is the health needs of your students. This will allow you to determine the issues in your district most in need of attention and will provide a greater understanding of the context which your health services are operating. And then you'll examine the extent to which your district's current health services and supports are meeting those needs. So you'll do this by completing the HATs. And we're going to look at that, as I had said earlier, shortly. There should be a good fit or alignment between the health needs of your students and your health services. If you do not have services and policies in place to meet a particular health need, then there is a gap. Conversely, if you're providing unneeded services, you are not making the best use of resources. All things to keep in mind. So we provided a worksheet, and you'll all get this in the email follow-up, with suggested data to collect on student health needs. You are not required to collect all of this data, and you may have your own ideas to add. This is simply to get you started and kind of give you an example. We ask that you compile whatever data that you were able to collect by our next session. And when looking at student needs data, think about the scope, like how big or extensive is the issue? And then also think about the severity. How serious are the consequences? And last but not least, equity. Are there certain groups of students disproportionately affected? There are a number of sources for data on student needs. The best place to start your health services is your student health services records. And some additional ideas are listed on this slide, including looking at student and attendance records, or talking with other internal partners. Outside of the school district, consider reaching out to state or local health departments, local medical facilities potentially, or academic institutions. I know in Brunswick that you guys are pretty close with and work very closely with your school health advisor. So of course, that's a resource as well. There are also data reports available from national surveys, such as the Youth Risk Behavior Surveillance System, the Kids Count Data Center, the Adolescent Behaviors and Experiences Survey, and the School Health Profiles. And then our state survey as well. I thought it was on this slide. But
Can I mention something, Tammy?
Yeah.
While you're talking about those national surveys, I just wanted to remind folks that in the Youth Risk Behavior Survey, the surveillance system, our Maine does participate in that. That is, we participate through the Maine Integrated Youth Health Survey. And not only can you get the national data and the state data, but when schools participate, they can also get their own school data as well. It's protected, so it's only the school staff can access that school specific data, but it could be valuable in looking at your own needs in your school district.
Thanks, Emily.
Yep. Just a plug there for if you haven't signed up yet for MIAS, make sure you do it.
I was going to MIAS next. I thought it was
Okay.
on this slide, but you said it beautifully, so thank you. When you're looking at those surveys, I want to say, MIAS, we can access that through our website too, right? Through the data page on our website, I believe.
Yes.
So,
Yep.
So when you go to the Guidelines for School Health Services webpage, you can access MIAS results through there as well if you are already signed up. So keep that in mind. If you're not signed up, it's a good thing. So looking at types of data, right? When we talk about collecting data, our minds tend to go straight to the numbers and the quantitative data, but remember that qualitative data can be equally important, particularly for capturing stakeholder perceptions and priorities, and can add a lot of depth and nuance to your understanding of a particular problem. You can gather qualitative data through informal conversations or through more formal methods like interviews or listening sessions. A helpful tip as you're collecting data is to look for ways to connect with issues that matter to decision makers. This will often mean connecting health outcomes with educational outcomes. So if your superintendent is concerned with attendance, for example, make the connection between on-site mental health services and student attendance. Down the road, this will help you to make the case for policy changes, resources, or other needed support. It will also remind education-focused decision makers that you're partners in accomplishing common goals. So to assess your district's health services, you'll use the HATS health services assessment tool for schools. Back in 2011, the AAP developed the HATS as a way for districts to assess the quality and comprehensiveness of their health services, the level of infrastructure to support those services, and the strength and implementation of school health services policies and protocols. Since its inception, HATS has been utilized by school districts across the country and was recently updated by an expert panel. The HATS sets a gold standard for comprehensive school health services that school districts can work toward. It's important to note that HATS is a self-assessment tool. It is not used as a way to evaluate school districts. So the information, this is your information for your district to help you. So the purpose of HATS is to enable districts to assess the strengths and weaknesses of their school health services, policies, protocols, and practices overall and within various categories. Evaluate the comprehensiveness of their school health services infrastructure, prioritize areas for improvement, and determine training, technical assistance, and professional development needs. Identify and prioritize funding needs, and track improvements over time. The person or department that oversees school health services for the district should lead the completion of the HATS with input from others who can assist in providing accurate answers to the questions, such as other school nurses in the district. Multiple users can be given access to the district's HATS, and we strongly encourage you to work on this as a team. Even if some of your team members are not able to help answer the questions, they will learn a lot by being part of the process and can provide guidance on best practices. All questions should be answered from a district level perspective. However, I know that some schools have also, that being said, some schools have participated individually, and that's okay too, if you cannot wrangle the whole district to be able to participate. And remember that the results are only helpful if they are accurate. So eliciting honest input is important to making the self-assessment process useful. We expect that it'll take 1 to 2 hours for you to complete the complete about 3 of the HATS modules. So it just really kind of depends how long it will take you on how much of the HATS assessment that you decide to complete at this time. If you wish to complete the full assessment, which we encourage, it will take a little longer, of course. And you can progress on the tool and complete it over the course of multiple sessions. You don't have to complete the questions in order. You can skip and come back to them later, especially if you need to go and look up, policies or things like that, or you get pulled away for student assessment or things. And then it is a time investment, but users have expressed that the process of completing the HATS is a valuable learning experience for everyone involved. So. We're going to do a quick tour just to make sure everybody knows where everything is. Some screenshots of how and walk you through how to use the HATS. Please just unmute anytime if you have any questions, or you can pop them into the chat box as well. All right, so if you haven't registered already, which it sounds like many of you have, you register with this little red registration button. If any of the features on the online tool are not functioning properly, please try using a different browser. Google Chrome is the preferred browser. Once you register your account and you're logged in, you'll be brought to your dashboard. As shown by the red arrows, you can start a new assessment by clicking on the hamburger drop-down menu icon in the right corner, then select Start a New Assessment link. As a handout, I think I provided the quick start guide in the last session. If you did not receive that, please let me know. And then we recommend that you print that out so you can refer to it if you need to when you're navigating through the hats. And for more detailed instructions, you can refer to this instructions tab. You see it right here, right under my dashboard is the instructions tab. Other information here includes a glossary of definitions and acronyms, which defines key terms used in the hats. The helpful resources provides a list of resources outlining best practices on health services that are referenced in the hats and frequently asked questions. If your team would like to work on hats together online, the invite a colleague function allows multiple individuals to work together on the same assessment. We suggest that team lead registers and then sends this link to the other team members just to make sure to coordinate so that multiple people aren't trying to answer the same questions at the same time. And I'm not sure if it says it, but this is a great, if you're doing the mental health component, inviting a colleague so that your mental health team partners can assist with that is helpful. So once you click on Start a New Assessment, you'll be brought to a page with some guidance around the questions, and you will then click on the Continue and Create New button. This will bring you to the Create New Assessment page, which is what is shown here. When you're ready to start the online assessment, enter a name for your assessment and click Create New District Assessment. At the state level, we did like what they did here, and we added the year so that every time that we create a new assessment and update it, we know what year it was from, and we're able to compare and contrast. And I'll be honest, I can't remember if it goes through this, if we talk about this later on or not. So I'm going to throw it out there right now. And if it does, then it'll just be a review. If you want to complete this again next year or 2 years from now, you can create a new assessment. You can import your old results and go through them and update them to be current. And it saves your previous data and then you also have the new data that you complete. So I really like that you can compare to previous year's assessment. So let's see, here we go. The first screen you'll see is the demographics. This is the only page of information that is required before you move on. For any other questions, you'll be able to skip ahead, complete the information, and then click next at the bottom of this page. And that will take you into the HATS questions. And then you'll then enter into the HATS modules menu. The HATS is divided into 8 modules: infrastructure, chronic condition management, emergency and disaster preparedness, mental health and social services, school-based screenings and preventative services, sexual and reproductive health, infectious disease prevention and management, and school-based health centers. While we encourage you to complete the full assessment again, we would like for you to try to do at least 3 modules. And I think maybe focusing on infrastructure, chronic condition management, and mental health and social services might be good recommended places to start. Once you make your module selections and hit the continue button, you'll be brought to the module breakdown where you can click on the sections within each module. Any questions so far? I feel like we've talked about a lot. Okay, we're going to keep going. If you start off with the infrastructure's first section, this is what you'll see. There are a few things I want to point out here. Glossary terms will be linked throughout the tool. If you'd like to see a definition, you can click on them. The Helpful Resources tab will bring up a list of relevant resources that outline best practices related to questions within the module. And down at the bottom of the screen, you can enter notes to yourself or to others who are working with you on the assessment. The notes are for the whole section, so be sure to include the question number if you're writing notes. As you answer the questions, new questions might appear or disappear depending on your response. Clicking back, next section, or save and exit will save your responses. If you work on the tool for a bit and you want to come back to it later, click save and exit. That will save your work. If you leave the HATS website and return later to continue working on the assessment, after you log back in, you'll be brought to your dashboard and all of your assessments will be listed. Since you've already started an assessment, you'll see this screen. You have several navigation options here now. You can go in and edit any of the modules you started, add modules, as well as see a report for the questions you responded to. Once you click on report, you will be brought to this screen where you will be able to see your score for each module and section. The online HATS is automatically scored. The scores are color-coded, red, yellow, and green. I added the scoring guide to help to the top of the slide here. Green, good job. Sorry, let's see if I can make that go away. Yellow, nice start, but room for improvement. And red would be like needs attention. This tool sets a very high benchmark, so you should expect to see and receive yellow and red scores for many areas. At the top, you can click open up a PDF of your summary scores and all the assessment questions with your responses. You can print or download and save those PDFs. Once you complete the HATS, you'll need to ensure all members of the team have a copy of the results. If you do not answer questions in a section, the bar will appear blank. Questions you leave blank are just not scored. Does that make sense to everybody so far? Okay. Here's a closer look at the summary PDF of the assessment report. For instance, you can see the module total score right here is 83 of 85 completed. And I'm not going to read all of these for you. It just means that you've skipped a couple of things here. And you can also see that reflected on the white part of the bar. And you can also see, obviously, this is the section that you're on. If you see a couple of red bars here, those might be, areas that you really want to look at first for focusing on. And then, section scores are calculated by summing the points for each completed section within the section and dividing by the total number of completed questions. So skipped or no answer responses within each section are excluded from score calculations. All right, so if it's, let's say, yellow here, it's not because you left a couple of questions open. Those questions are not included. Okay, does that make sense? So individuals who have access to your HATS online will be able to view all of the results, but it's up to you whether or not to share the results with others. Teams project staff will use the results and aggregate to identify trends in school services, but not identify individual districts without permission, if that makes sense. Okay. So HAT, again, is extremely comprehensive, takes time to complete. You might want to plan to complete in a couple of sessions. The most time-consuming aspect of completing HATs is often compiling the information needed to answer the questions. You can print a blank copy of the HATs to preview the questions. Compiling your district's health services policies and protocols before you start will allow you to complete your assessment more quickly. Before you dive in, decide how your team or any others who will be part of completing the HATs would like to collaborate. Will you meet in person, complete it together? Will one person complete it and then the team will discuss and update the responses during a meeting? Will you divide up the sections and then discuss all together? It's also helpful to make sure everyone is on the same page in terms of how they are interpreting and responding to questions. And yeah. Once you've completed the HATs, take a look at the results and celebrate your areas of strength. Then look over the red and yellow areas and start thinking about areas of concern. During our immersive training, you'll look at the HATs results alongside additional school health data your team collected and use that information to prioritize your key issues. And bringing this data will give you information that you need to dive into the next steps of strategic planning during the session. And over the next few weeks, you'll focus on gathering data and then completing the modules. Any questions? That was a lot.
There are no questions in the chat, Tammy.
Okay.
Jen and I think we're the only ones who are
Yeah.
school-based, and we've already gone through this, so this is review for us.
Okay, you've already done all the things.
Yeah.
Okay.
Yeah.
Well, let's skip way ahead then. How does that sound? Oh, you know what? This is like our last slides anyway. So yeah, we're wrapping up. This is the very end of today's session. So let's talk about concerns that you have and areas that we might be able to support you. And I think we can stop the recording now.